it's not just the black ice, but it's the chance, for power outages and all that stuff. So that's where I feel like we really ramp things up, is if there's a chance for ice. If it's snow, it's all fun and games on live weather impact. But if it's ice, it might be a different story.
Nobody's disappointed when you don't get a ton of ice, that's for sure. Ice is so bad, and such a big part of our Carolina climatology in the wintertime are horrible ice storms. And we've also, we've been, in a snow drought of sorts. We've been pretty fortunate not to have too many huge ice events either, at least not devastating ones. You look back through some of the history, gosh, we've had some 1-inch freezing rain events sometimes that have, done power outages for more than a week for some places. It's been a while since we've had really, really bad ones like that, and I hope that stays to be the case, because there's nothing fun about freezing rain whatsoever.
Yeah, definitely not. And I think the big thing with power lines, we saw that I don't even remember which winter it was, but we saw that a few winters ago, where there was those crazy ice storms in Texas, and unfortunately all those people died from their power outages and things like that. And we can have crazy power outages here in Charlotte as well. I think of Christmas Eve 2022 when it was 9 degrees Christmas Eve morning, and there was definitely some power loss.
Yeah, because it was so windy, too. So with the wind and the power outages and the cold air, that was just, a mix of all sorts of bad outcomes. But, we're talking all about the snow. If we had to do any sort of long-ranging right now, I think we can guarantee the next 7 days are pretty snow-free. And beyond that, while it had been looking a little more interesting toward the second week of January, now that doesn't really look that interesting for winter potential anymore. And I kind of try and count the weeks. If you're a snow lover or a snow hater, they're both. How many weeks are still on the table? All of January, all of February, usually like the first 2 weeks of March are options for trying to cash in on something. That's only about 10 weeks left. So, there's still plenty of time, but we're going to, watch it 1 week at a time.
That's wild. Only 10 weeks left. All right, before we go, we have about 30 seconds before the show ends. So sad. Do you have any resolutions, or maybe weather resolutions for the winter in Greensboro that you want to put out there? Maybe some manifestation?
Only accurate snow forecasts will be posted and talked about. And I hope that we get 2 snow events. 2 snow events is my hope for all of you in the next couple of months. Well, how about you? What is your weather resolution?
I think 2 snow events is fair, and I think you can guarantee that you won't be finding us posting crazy model statistics on social media. That's pretty much a guarantee.
Happy New Year, everybody.
Yes, Happy New Year.
Be safe. Have a fun night. We'll see you tomorrow.
Tim. Happy New Year. See you next year, friend.
See ya.
Thanks for joining us here on WCNC Charlotte Impact Studio on WCNC Plus. We're going to get more from the Trump administration right now about the frozen federal child care funding for all 50 states. Let's listen into this right now. So we do not know much about it other than the fact that the administration has frozen this federal child care funding for all 50 states. So let me pull this up here in 1 second. The Trump administration has frozen these funds to all states after allegations of fraud at Minnesota daycare centers run by Somali residents. The Trump administration has said it is freezing child care funds to all states until they provide more verification about the programs, in a move fueled by a series of fraud schemes at Minnesota daycare centers run by Somali residents. So all 50 states will be impacted by the review, but the Republican administration is focusing most of its ire on the blue state of Minnesota and is calling for an audit of some of its centers right now. So we do know that Minnesota Democratic Attorney General Keith Ellison said in a statement Wednesday that he was exploring all legal options to ensure that critical child care services do not get abruptly slashed based on pretext and grandstanding. It is unclear how much robust verification is needed for these states in this process, and it already has started in terms of people looking at this and what is being needed. So more verification is needed for all states to get the child care funds. In fact, all 50 states will have to provide additional levels of verification and administrative data before they receive more funding from the Child Care and Development Fund. So it says, however, Minnesota will have to provide even more verification for child care centers that are suspected of fraud, such as attendance and licensing records, past enforcement actions, and inspection reports. All right, we're going to go more for child health care officials from Minnesota.
Hello and welcome. Let me try this again. I can't speak today. Hello and welcome. Thank you all for being here today. I'm Amanda Schillinger, and I'm a Child Care Center Director. My name is spelled AMANDASCHILLINGER. Many people in our child care community are afraid to come forward and share their stories today because they are being targeted. I am glad to be able to be here today to speak in support of them. Here's what I would love to be doing right now today as a Child Care Center Director. I would love to be singing and dancing and playing and reading with children. I'd love to be welcoming families and supporting staff. I would even love to be doing year-end paperwork, but instead, I need to be here. I need to be supporting our childcare industry and the hardworking and dedicated Somali childcare community who are being unfairly vilified, and to make sure that our families and families throughout this great state have childcare and early learning programs for their children, and to make sure our staff have jobs. So let's be honest about how we really got here. Our president decided he doesn't like the Somali community and he wants to destroy them. Speaker DeMuth and the GOP caucus sent a YouTuber out to create the narrative they want out there, not the truth, what they want you to believe. The child care system in Minnesota is very complicated, even for those of us who have worked in it for decades. So I can understand that it is easy to believe what you see on social media. But the truth is that Minnesota has guardrails in place to make defrauding the child care system extremely difficult. Minnesota does investigate suspected fraud in child care and hold people accountable, and they will continue to do so because fraud is never acceptable. But cutting off child care funding to everyone in the state is not the answer, and it's not acceptable. So what does it look like when Minnesota child care funding is frozen? Over 20,000 children in over 4,000 programs across our state will lose access to child care and early learning. Their families will not be able to go to work because they don't have child care. Our child care center and others like us will have to close our doors. 75% of the children at our program qualify through the state for child care funding. We can't afford to continue to operate if we lose 75% of our enrollment. Without child care assistance funding, our center will close within a month. As those families no longer have money to spend because they don't have jobs, because they don't have child care. Other businesses in our communities will be impacted by a loss of workforce and by a loss of income. And many will have to close their doors as well. You see, freezing child care funding does not just impact families and children, it impacts everyone. During the COVID pandemic, we learned how vital child care was to sustaining our state and country. If we allow this funding freeze to happen, all Minnesotans are going to suffer. We cannot succumb to hate and fear-mongering. It is not who we are as Minnesotans. We are people who surround our communities with love and support. So instead of tearing down our Somali community and our child care centers, let's lift them up. Let's make sure that our children have safe places to learn and grow.
Good morning, everyone. I'm not much of a good speaker, but I'll try my best. My name is Deco Noor. I'm a parent who receives federal funding for childcare for my kiddo. Over 20,000 kids will lose access to childcare programs. And that, that 20,000, thousands of children rely on childcare, and thousands of parents rely on childcare. Therefore, if childcare will, oh my God. I'm currently a medical student. I rely on childcare. I work. If childcare is cut, I'm unable to work or go to school. I understand fraud is bad.
Good afternoon. Thank you all for being here. My name is Carly Gatiza-Wattoon. I am state representative. I am the DFL co-chair of the Children and Families Committee in the Minnesota House of Representatives. Our job as lawmakers is to show up every day to make Minnesotans' lives better. And Minnesotans deserve to be able to trust that each and every taxpayer dollar is being used responsibly to meet our collective needs. And due to bad actors, that trust is in jeopardy. I'm just as mad as you are. Criminals taking any dollar that is meant to help children and families in the state of Minnesota is completely unacceptable. We're taking fraud seriously. We're working every day to improve our systems, hold those criminals accountable, and move our state forward. That's why it's incredibly frustrating to me that Donald Trump and Republicans want to use this as a political vehicle to cut funding entirely to our state. It's irresponsible. That's right. It's irresponsible at best, and it's despicable at worst to cast blanket dispersions on those caring for our littlest Minnesotans, particularly those of Somali American descent. Imagine if a few people stole food from one of the nation's largest grocers, and instead of strengthening their safeguards, they just decided to stop selling food entirely. Imagine that the country's largest health insurance provider was under federal investigation due to fraudulent claims. And before that investigation was complete, the government just decided to stop funding Medicare and Medicaid entirely. Using a broad brush to eliminate the very programs that are helping Minnesotan families is not the answer. That's right. Fraud prevention is about policy and not politics. It's about solutions and not spectacle. But everything that we've seen from the federal government this week is about politics. President Trump is targeting Minnesota because his goal is to distract, divide, and demonize. He has shown over and over again that instead of working to solve problems, he points fingers and places blame on a particular group of people. In order to distract Minnesotans from his unpopularity, his failed tariffs and rising prices, his corruption, he's attacking and defunding Minnesota. In an effort to divide us, he calls our neighbors garbage. And instead of seeking bipartisan solutions, he demonizes and attacks his political opponents. The reality is, Minnesota is one of the best states in the country to raise a family, start a business, or retire. And freezing these child care assistance funds directly impacts small businesses statewide at a time when employers are already struggling to keep their doors open and parents already can't afford early care and learning options. The federal government now will be keeping even more of our tax dollars, although Minnesotans already give more than we receive. It is my understanding that the Department of Children, Youth and Families is working with their county partners, the teams at the OIG and the BCA on reports of alleged fraud, while the Trump administration continues to find any reason to defund public programs in order to give tax cuts to billionaires. Here in Minnesota, we are going to stay focused on fraud prevention and solutions that will actually make Minnesotans' lives better. DFLers will be doing everything that we can this session on top of fraud prevention to make sure that Minnesota stays a great place to live, work, and raise a family, even as Trump works to defund our state. Thank you.
Hi, my name is Karen Moratz, C-A-R-I-N-M-R-O-T-Z, and I work in the Minnesota Attorney General's office, and I'm here to share a statement from Minnesota Attorney General Keith Ellison. The Trump administration is threatening funding for the essential child care services that countless families across Minnesota rely on, apparently all on the basis of one video on social media. To say I am outraged is an understatement. Let me be clear, fraud is unacceptable and individuals responsible for it should be prosecuted. I've been holding fraudsters and scammers accountable for years and will continue to do so. Since I was first elected Attorney General, my office has prosecuted over 300 cases of Medicaid fraud and won over $80 million in judgments and restitution. And that's not counting our success in going after private sector scammers who rip off Minnesota consumers. Last year, I led a bipartisan push at the Minnesota legislature to expand the resources and tools available to my Medicaid fraud team, and I plan to do that again this year. What I will not do, if it is all within my power, is let the Trump administration devastate funding for services that Minnesota families depend on to afford their lives. We've seen this move before. In mid-December, the Trump administration gave 4 counties in Minnesota 1 month to conduct in-person interviews with almost 100,000 households that receive SNAP benefits to re-verify their eligibility. This demand was both impossible to complete and unnecessary, as SNAP recipients are already re-verified roughly once a year. The Trump administration threatened to cut off food support for almost 500,000 Minnesotans, including over 150,000 children, if Minnesota did not comply with this impossible demand. Just last week, I sued to stop that cruelty. And not for the first time, I filed this latest lawsuit just 6 weeks after I sued the Trump administration to stop the Trump administration from taking food off the tables of low-income Minnesotans during his government shutdown, and we won. There are legal and appropriate ways for the federal and state government to ensure that programs are being administered with integrity. As we have seen time and time again this year, however, this administration seems to have little interest in following the law, including laws that are designed to help state and federal agencies work together. My team and I are exploring all our legal options to ensure that critical child care services do not get abruptly slashed based on pretext and grandstanding. This hasty, scorched earth attack is not just wrong, it may well be illegal, and my team and I remain committed to protecting the people of Minnesota to the fullest extent of the law. Thank you.
Hi, I'm Maria Snyder, and I'm a little nervous. nervous to be here today with you all. I'm a director of a child care center here in St. Paul, and I'm really proud of the work that we do at my center and across this state to provide care for children and families. Deco just let me know that she had to skip school today and she just got emotional being here, and I feel like we all are feeling that same way. Like, it's just the emotions are right there. It's not lost on me that there are providers who would want to be here but are afraid to be here. We all know, like, Melissa Hortman served here at this Capitol. Senator Hoffman continues to serve, and I'm here to speak because God didn't give me a spirit of fear, and I'm here to speak up on behalf of children and families and providers, and no one invites children to come speak at these things, so here I am, you get me. My center was opened by my mom in 1998. She was a family advocate, and she saw that there was a really huge need for affordable child care that was full-time in our city. So she opened our center, and like I said, we've been really proud to accept child care assistance from the beginning because we believe that every child deserves access to high-quality early learning.
Yes. 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 Right.
Many of the families at my center are one paycheck away from becoming homeless. I'm not exaggerating. If child care assistance is turned off, children can't come to care. That means their parents can't go to work. If they don't go to work, they don't get paid. They risk losing their jobs. If that happens, they cannot make their rent check that month. Many families in Minnesota are living paycheck to paycheck as it is. It's not right. And I'm emotional too, so I apologize. I'm doing my best. In many cases, child care assistance is a crucial piece of survival. I'm generally scared for what can happen next if funding is stopped, and I can't help but think that this is part of a larger designed plan and strategy to cut public funding. And I do see some signs over here that say stop fraud, and I agree, stop it. There are wait lists for these programs that are years long. There is fraud, the fraud that is occurring is not at the hands of families. We need to be looking at who's in power, who's making decisions, who's guarding the purse strings of our tax dollars, my tax dollars too, and making sure that children have places to go that are safe for them to learn, parents can go to work, and providers can keep their doors open. That's right. That's what I have to say. I went a little off script. Thank you. We would like to open this up for questions.
We have a question for Karen at the AG's office. Can you address some of the inspection process? What sort of signs of fraud do inspectors look for when they're doing these inspections?
I can speak to it. I've been part of investigations.
Yeah, I would love for the provider who's been part of one of those investigations to speak to her experience, and if you have follow-up questions about that, you can speak with our press team.
Sure. We have reached out to the state officials and no one's gone back to it. So if you can shed some light on it, that'd be great.
So my experience is that child care providers are part of randomized audits all the time for child care assistance. I've been in charge of child care assistance at my program since about 2010. They come, they ask you for your attendance records. It is extremely detailed. Any information that you don't provide to them on that day, you cannot go back and say, oh, wait, I forgot this one, or oh, maybe this one was wrong, can I correct it? Yep. There's no room for that. They're looking at very detailed things, like, for example, if you have an X instead of an A for absent, that's considered a ding against you. That's something that they'll write you a letter that says this is a citation for suspected fraud for an X instead of an A. So imagine my surprise at this narrative that it's so easy to scam child care assistance.
Is that different than the safety violations, that inspection visits?
Yes, they are different.
So when the DCYF said earlier this week that they had found, no findings of fraud, is she speaking to something different than those site visits for safety violations?
I can't speak to what that specific person is speaking to, but my understanding is how the systems operate is DCYF houses both child care assistance and licensing, but they operate separately. Does that make sense?
So the new requirements that were announced today, what's new compared to what? Compared to the process you just described, what are you being asked to do now? What is different? What's your understanding of that?
I don't have have a very good understanding of that. I have seen what you have all seen from the federal government, which was a tweet that said photos and receipts. Like I said, we're family-owned business, so my mom called me and said, well, write to them and tell them that we'll, whatever they want, we'll send. And we will, because we want kids to come to our centers. So I have no problem complying with anything that they want.
This is a follow-up for the AG's office.
Okay. I just wanted to step in and I address briefly the question about whether or not the health and safety visits are corresponding with some of the reports of fraud. It's my understanding that some of these more recent allegations of fraud are based on the idea that there aren't any children in these centers, and that they're falsifying attendance records to gather taxpayer dollars for children who aren't actually attending the program. But when DCYF investigators go and check on health and safety visits, they usually see children at the centers, so I think that they are connected, but perhaps not in the way that you're asking.
They're looking at how many kids each time they're going in. Is that your understanding?
I don't. They
Ask us to count our kids every time they come to visit.
Every day.
How many kids are enrolled? How many kids are here today?
Who signed them in and out?
How
all
many
right.
kids are enrolled?
Next.
Oh, this is a follow-up question. Do you guys have any results from the DCYF investigations on Monday where they went and checked the child care centers that were featured in the video?
Right, yes. So I am not able to speak to that as it is an ongoing investigation, but we have reached out to the department. We are in touch with them. We're looking for, to hear back on the standard review. Yep.
I have a clarifying question on this.
Can you speak about the different times that daycare is open? The different hours, specific hours, after school hours?
Oh, right. Well, I think, every daycare center gets to set their own hours. We have very few centers in Minnesota that operate outside of typical business hours between maybe 6 a.m. and 6 p.m., depending on their location. In fact, I think it would be really beneficial if we could expand upon that for folks who work third shift and folks up on the Iron Range who work non-traditional hours as well. So that's something that we're actually considering in committee and how we can support providers. But it just is different at every center, I think. So,
Representative, you mentioned that this broad strokes approach is not appropriate in your view from the federal government. Standing here today, whether it's the daycare centers that were included in that video or in other parts of Minnesota, are you confident, based on your work in this chamber, that there is not any widespread fraud going on?
It's very difficult to prove a negative. I think that we have to be very careful when we base allegations on the amount of funding that goes to child care providers for providing child care. We can't just look at the amount of money that they've billed and then say, where are these millions of dollars going? Child care is very expensive. Minnesota is one of the more expensive states in the nation to afford child care. And we break it down. If we do simple back of the napkin math, you divide 1.4 or 1.7 million dollars by 52 weeks, it's closer to $32,000. You divide that by 40 hours a week on average, you get closer to $817 per child. These aren't exorbitant amounts of money, they're just real numbers because it is costly to provide quality care for kids.
Could a provider talk about exactly when they will feel the impacts of the freeze?
Does that you wanted to speak to that?
I would love information on that. I don't have any. We have not been given any. I don't know.
When do you typically receive the equivalent of a check?
We get paid after services are rendered. So we complete our billing process. We submit them to the county for payment. I believe the statute is within 21 days of the receipt of the bill we're supposed to get paid. Your guess is as good as mine if we're going to get paid or not.
There's a question down here, sorry, in the floor.
I guess I'm trying to get behind how restrictive this additional oversight is. Is there a reason that the state could not provide the federal government the requested records in time to make sure funding is released as scheduled?
So if I'm understanding your question correctly, you are asking about like the photos and the information that was put out via social media instead of an actual official letter to our state government, which seems like a weird way to govern to me, but
Well, there was
nonetheless.
a demand letter to the governor's
Yes.
office,
After the fact, after the tweet came out. So, we're gathering, DCYF is gathering information as best they can. They've done much outreach to the federal government to try to clarify. But as of right now, I mean, we have not been requiring photos of some of these logs, these sorts of things. And it is something that we can take under guidance when we return to the legislative session. And that's something that we've been doing for years, actually, working on child care assistance and strengthening the program integrity. We've been working on all of that with the new Department of Children, Youth, and Families. And I think that just it's happening so quickly that we just have to make sure that we are getting clarity on what they're actually asking for and what they're going to be requiring. But right now the monies are frozen, and we haven't gotten all the detail that we need.
In 2014, when Minnesota made national news, were you with the meeting?
Yeah, let's get one because this gentleman was up next, actually, with the purple flag.
Electronic attendance.
Oh, yes.
Can you address that? Is that in place now? Is that planned to be enacted soon?
Yes. So the question was about electronic attendance monitoring, which is something that the federal government has been requiring. Minnesota has gotten a waiver for it over past years, and we have appropriated funding for the program. It will be going into effect actually in June of 2026. So we're just months away from full implementation of that, but it has been an ongoing work.
And we'll be happy to answer further questions. We're going to have to wrap things up at this point. We're so grateful to all of you for being here and for all of your work. We'll continue to talk. Thank you so much.
Thanks.
And many thanks to all of you.
Happy New Year.
All right, folks, we're going to take a quick 2-minute break, check on some New Year's Eve celebrations around the world when we come back. All right, welcome back, everyone. I'm sure you've heard that flu cases are really rising across the Carolinas, specifically in North Carolina. And Novant doctors gave an update on where cases stand, really just beginning this season, and it could get a lot worse. So let's go to them right now.
Just a few comments I'll make about influenza and respiratory virus season. And if you can't hear me, please let me know as I'm kind of managing all the technologies. It's that time of year. So respiratory virus season is here. It is typically between November and March for us in healthcare. And really during that period, we see this increase in infections from several respiratory viruses, mainly influenza, COVID, and RSV, or respiratory syncytial virus. But there are other viruses that float around as well. It's really what happens this time of year. Over the last couple of weeks, our healthcare system has seen some significant increases in influenza cases in particular. In our clinic, clinics, our emergency rooms, our hospitals, and I think that trend will continue in the next few weeks as everyone is gathered for the holidays, and will continue to gather around the new year, that these viruses will get spread in our communities. I can tell you over the last week, week over week, our hospitals and emergency departments have experienced a 2.5 times increase in positive flu cases. We're also seeing some increase in RSV, that respiratory syncytial virus, which is typically a wintertime infection. So we're not surprised by any of this. It's just every year it happens a little bit of a different time, and that's what's happening now. If you look statewide, the state of North Carolina is also seeing some increases in the respiratory virus activity in the emergency departments. That's continuing to go up, and we're seeing that nationwide. So if you look at the state of North Carolina data or CDC data, we see the same things. I'll tell you the dominant strain out there is an influenza A, which is H3N2. Influenza A is the most common flu we see each year. This one's a little bit different. It comes from a subclade called K, like the letter K. We haven't seen that one as much before. It's unclear if that strain has more severe disease, but it may be more contagious because it is the dominant strain. It's the thing that's being spread around the most in our communities. I do get asked sometimes, how do we distinguish the symptoms of the flu versus the symptoms of RSV versus the symptoms of COVID? That's hard to do, even for experienced physicians, but kind of the general rule of thumb as we think about those different viruses is when people tell me about influenza, they talk about it coming on very suddenly. They feel like they have a high fever, and they particularly have these muscle aches. And they'll describe it as, I felt like I was hit by a truck. That's the phrase you hear the most. COVID tends to come on over a little bit longer period of time, maybe a few days. You get fever, sore throat, congestion, runny nose. It doesn't have that hit by a truck feeling. So those aren't perfect descriptions, but the best way to determine what virus you have is to be tested. And there's some testing modalities out there, some testing you can do with home tests, at urgent cares, at your doctor's office. So that's the best way to distinguish the viruses. But if I had to think of them in different categories, I would describe it that way. How do we prevent all of this? How do we reduce our risk in respiratory virus season? First and foremost is vaccination. It's highly recommended. It's safe. It's very useful for respiratory viruses. Influenza is preventable. People over the age of 6 months should consider vaccination. And vaccines can prevent infections like the flu, but also reducing the severity of the flu if you do get it. They're not perfect. We know that, but they can make your infection less severe, which could be important. I'll say that we talked about testing a second ago. Early testing for respiratory viruses is advisable if you have symptoms. If you're going to be tested, do it soon, particularly if you have risk for complications. So if you're someone with diabetes or lung disease or heart disease or cancer or immune system issues, you want to be tested, and you want to do it early because treatments for flu and COVID exist, but they're better to get them started within a couple of days of your symptoms and not wait longer. Other ways to reduce your risk or help the community is stay at home when you're sick, stay home from work or school. Consider antiviral medications. Your doctor can tell you if you're a candidate for that for both flu and COVID. We tell people wash your hands, clean surfaces around you, and consider using a mask, particularly in crowded settings, to help lower your infection risk. One comment I want to make before I kind of wrap up here is, and we don't emphasize this enough, when you prevent something like the flu or COVID, it's important to do that to avoid getting the virus, but you're also avoiding the serious complications that can come on after those viral infections. And we do not talk about this enough, and we should. When people have flu and COVID, your risk in the next few weeks for heart attack, stroke, pneumonia, sepsis, all of those things go up. Because when you get those infections, those viruses cause inflammation in your body, particularly your blood vessels. And so if you're at risk of having a heart attack or a stroke or pneumonia or sepsis, that inflammation can lead to those things. So you talk to physicians and APPs and nurses that work in emergency departments this time of year, they will tell you that people come in with heart attack and stroke and pneumonia and sepsis. If you ask them, have you had a respiratory virus in the last few weeks, they will often say yes. So getting vaccinated, preventing getting these infections infections is not just about, hey, I'm avoiding getting the virus, I was going to get over it anyway. There are serious and sometimes fatal complications from these viruses that you're helping prevent by protecting yourself. And while those things can occur in anyone, they're particularly more likely in older adults. And again, diabetes, heart and lung disease, cancer, immune system issues, those are the things that people, and when you have those things, your risk of complications from these viruses really goes up. And lastly, I'll say there are antiviral medications for flu and COVID. For flu, some of them are just one pill, some take several days of therapy, but it's best to talk to your doctor about what the best options for you would be. And you want to do that quickly, because if you're going to take those medications, as I mentioned, you want to take those within 48 hours of your symptom onset. So talk to your doctor if those are best for you. And with that, I will take any questions.
Dr. Priest, I'll kick us off. For anybody who has spent a lot of time with family at the holidays and inevitably heard so-and-so had the flu after, what is the incubation period like for influenza where you should really be on high alert?
Yeah, I would say for the next week. So that's the kind of time to think about it. And we run into those situations, right? You go to the public gathering, the family gathering, and you weren't told that so-and-so was sick, or you find out a little bit later. So you have to think about taking precautions. There are some very immunocompromised people who, when they're exposed to flu, should probably talk to their doctors about whether it would be beneficial for them to take an antiviral medication if they've had a really high risk exposure. So it's worth talking to your doctor about that.
And how are the case rate that we're seeing right now comparative to year over year? It seems like you're reading about it more every year, but I also know that we say that every year.
Yeah, I mean, in our system, in our healthcare system in North and South Carolina, what we're seeing is we're peaking a little bit earlier than we did last year. It just depends on the year. A big peak generally comes, and sometimes it's December, January, or February. I think we're peaking a little bit earlier than we have in recent years, but nothing that seems particularly out of the ordinary to us in terms of number of cases.
Great. Any of our media partners who are on, do you have questions for Dr. Priest?
I have one, Caroline. Dr. Priest, you mentioned vaccines, but we know it's a little bit late in the season. Kids have been out now for the holidays, and they are returning back to schools next week and later. Is it too late to get the vaccine? What should families know as far as the timing goes?
Yeah, great question. It is not too late to get the vaccine, but I think as you're alluding to, when you get the vaccine, you're not instantly protected. It takes a couple of weeks for your immune system to respond to that vaccine. So the sooner the better. Now, I don't know when the true peak of these cases is going to come, probably in the next couple of weeks. So it is worth going ahead and getting vaccinated. It's not too late. And the peak may come later in January. And if you get vaccinated now, you can be protected. And every once in a while, we have years where we have two peaks. So sometimes later in a flu season, influenza B will show up, and the vaccine includes protection against influenza B. And so it's worth going ahead and get vaccinated. It's not too late. And the vaccine is available in your local drugstores, your physician's offices, local health departments have it, so it's worth getting.
And just for parents out, oh, go ahead.
Oh, sorry. If someone has the flu, how long are they contagious?
Yeah, so it's generally for about 24 hours after their fever is gone. So it's one of those things where you watch and follow. When your fever is gone, you wait about 24 hours, and then you're no longer shedding virus or contagious. So it's really around when the fever ends and when your symptoms get better.
What have you seen ramp up so far this season to kind of contribute to the restrictions for some of these visitors? I mean, it has to be intense, or more intense this year if the visitations have been restricted for certain hospitals. So what are some of the new ramps you've seen for this particular season?
Yeah, we actually restrict visitors almost every year, and we often do that in collaboration with other regional healthcare systems. We talk to them frequently, and the great thing about that is we all collectively really care about our communities, and we want to give consistent messaging about all of this. So it's not so much that this year is worse than others. We do this most years. We do it because, interestingly, children can often carry influenza virus, and they don't have symptoms at all, or their symptoms are really really mild. And so we understand the desire that you might want to bring a child into a hospital to visit a loved one, but the hospital is full of people that are really vulnerable to flu, and we don't want our healthcare workers to get flu either. And so we kind of take this step every year to say we don't want to bring extra respiratory viruses into our hospitals. Now, there are exceptions to that in our healthcare system. So our teams will work with families. If there's a reason a child needs to come in the hospital, maybe it's an end of life issue for a loved one, or a sibling visiting a new sibling after their mom's had a baby. So we will work with families to make sure those things happen. But in general, just general visitation's not great. And we just decide to do this every year as we monitor that respiratory virus activity and say, okay, now's the time. It's a little different every year, but now's the time to say, let's keep some folks out of the hospital for a few weeks just to keep people safe.
Any other questions for Dr. Priest?
When should someone who's sick with the flu go to the doctor?
Yeah, so that's a really good question. I think the first thing to know is about your own healthcare problems, right? So if you're an older adult, diabetes, heart disease, lung disease, cancer, immune system issues, you should err on the side of talking to your doctor sooner. First, you should be vaccinated against these viruses to protect you. But if you're starting to develop those symptoms, talk to your doctor. So many doctors now take electronic messages. You can call the office, you can send a message and say, hey, I have some risk factors for complications of these viruses, and I have symptoms. What do you advise me to do? And I think they'll advise you to be tested early and to go on antiviral medications if that's the right thing for you. Now, a younger person who has zero health problems, whose symptoms are mild, that's someone who is less at risk for those complications, but should certainly consider staying home from work or school and potentially get tested to make sure they're protecting those around them. Because remember, we do all this together. It's our communities trying to protect each other and protect the most vulnerable among us. And so we have to think about that as we have these infections. So just know about your own health problems and what risk you might have, and then talk to your doctor about what's best for you.
All right, folks, we're going to take a quick 2-minute break, and of course, we'll be back right here on WCNC Plus. See you in 2. All right, everybody, we are back, and from flu now to measles, and we just got the first case in North Carolina confirmed today. So let's listen in on South Carolina and where measles cases there are, because they are expanding in numbers.
I'll leave things off to Dr. Bell now. Casey, thank you. I'm having a few technical problems this morning. Are we okay with the audio?
Yep, sounds good, and your camera's on as well.
Okay, thank you so much, and good afternoon, everyone. On Tuesday, the South Carolina Department of Public Health reported 20 new cases of measles in the state since Friday, which brings the total number of cases in South Carolina related to the upstate outbreak to 176, and the total number reported to DPH this year to 179. 7 of the new cases were known household exposures. 5 resulted from a previously reported school exposure, 2 resulted from an exposure at church, and 1 resulted from an exposure at either school or church. The sources of 4 cases are unknown and still under investigation, and all of the new cases are Spartanburg County residents. In total, there are currently 287 people in quarantine and 2 in isolation. The latest end date of quarantine for these is January the 21st, meaning that we expect to continue to see cases well into January. Complications from measles are not reportable, but we have learned that 3 people with measles required hospitalization for complications. Both adults and children were involved. And to protect privacy, we do not provide personal details or specifics of clinical outcomes or the status of these cases. DPH encourages those potentially exposed to notify a healthcare provider of a possible measles exposure before seeking care, to allow arrangements to be made in clinical settings to protect others, as clinical settings have been settings where public exposures have occurred. One of our priorities is protecting the public from preventable exposures by implementing quarantine measures to help stop the spread of measles. So it's very important for those who have, even mild illnesses or who are in quarantine to stay home to protect others because they may not be aware that they can spread the disease. Vaccination continues to be the best way to prevent measles and to stop this outbreak. And we know the vaccination status of 170 of the 176 outbreak-related cases, and 99% of them are unvaccinated. So this speaks to the protection that vaccination brings as the best way to protect people against measles, to prevent ongoing spread in our communities, and to stop this outbreak. We remind people that vaccines are available at many primary care providers' offices and pharmacies, as well as at DPH Health Department clinics. And any community partner or organization interested in scheduling a vaccination event from DPH's mobile health unit can request a visit to their location by completing the form found on the DPH website. And with that update, I will turn it over to questions. Thank you very much.
Thank you, Dr. Bell. And everyone, I think most of you know the drill, but if you don't mind raising your hand, we'll call on you in the order you raise your hand in. And if you don't mind, when you do ask your question, to say your name and the name of the outlet you work with. And it looks like Tom's got a question. Tom?
Hi, Tom Corwin, Post and Courier. So earlier this week, DPH also put out the status of outbreaks of other vaccine-preventable viruses in the upstate. A number of outbreaks of pertussis, whooping cough, of measles as well. Does this, I think, add to the point about the need for vaccination?
It does add to the importance of vaccination, because we are seeing in a higher number of vaccine-preventable disease outbreaks in the upstate, which is an area of our state that has among the lowest vaccination coverage. So as we would expect with lower vaccination coverage for other vaccine-preventable diseases, we are seeing higher rates of varicella or chickenpox, or pertussis and whooping cough, as you mentioned. This raises concerns for the flu as we are moving into widespread flu transmission in the state. And so, yes, this is a concern, not just for measles, but we have a number of vaccine preventable diseases that people could be protected against if we were able to get our vaccination coverage up more widely.
Thank you. Thank you. And Mackenzie?
Hi, Mackenzie Musket, Spectrum News. I just wanted to pivot to the flu for a second. I know today the CDC bumped up South Carolina as having a very high activity level. And I know today Prisma Health and some other hospitals aren't letting children visit their hospitals. So how worried should people be about the flu this season? And how is this going to affect children now that we're seeing a measles outbreak and a very high widespread flu season?
Well, we're not asking people to be worried. We want people to be prepared and we want people to be informed. And so it is important information to know that influenza activity in the state is now widespread for 2 consecutive weeks. We want people to be informed that the vaccination against the flu is recommended for everyone 6 months of age and older, unless they have a contraindication every year, because this is what gives people the protection from the vaccine that's developed to be well matched against the most commonly circulating strains. We want people to be aware that with flu activity now on the increase, if they choose to get vaccinated, it actually takes about 2 weeks for the body to mount a immune response that is strong enough to protect them against flu infection or complications from the flu. And so those are all points that we want people to be aware of. This is an opportunity to be prepared. We can't anticipate when an exposure might occur, and so vaccination now will protect people throughout the flu season that we define as beginning in October and moving well into the spring. We continue to see flu activity as late as March and April, and we can see from one season to the next, it's unpredictable how severe the flu season might be. But an important point I want to make is regardless of the severity of the flu in each season, we see hospitalizations and deaths from flu, even in relatively mild seasons. So we want to encourage people to be aware of that and to get protected now.
Thank you, Dr. Bell. Peyton?
Hi, yeah, Peyton Furtado, WYFF News. Linda, we talked yesterday about the flu, but today we're talking about measles. We saw that one of the people in your press release is fully vaccinated and still contracted it. Is it at all possible, even if you are fully vaccinated, for your immunity to the measles to wear off as time goes on?
We don't generally see waning immunity from measles vaccination. We know that no vaccination offers 100% protection, but the measles vaccine is one of the most effective vaccines that we have available. And in fact, for about 97% of people who receive
4:30s by the time we reach midnight. We're also looking ahead towards, of course, your New Year's forecast. As we look.
Sorry, let me mute myself if that's me.
Okay. Yeah, just wanted to continue with that, to let people know that the measles vaccine is one of the most effective that we know of. And in fact, about 97% of the people who get the recommended 2-dose schedule will have lifelong immunity. So it's not a question of waning immunity. It's just that a small percentage of people actually don't respond. But as I mentioned earlier, it offers great protection because 99% of our cases for whom we have vaccination status are unvaccinated. And that tells us about the protection that the measles vaccine offers.
Thank you, Dr. Bell. Aria?
Hi there, this is Aria Bendix with NBC News. Linda, how would you characterize where we are in the trajectory of this outbreak? Would we say cases are still rapidly accelerating? And what does this mean for the country's elimination status for measles?
Well, it's difficult to say where we are in the trajectory in South Carolina because, as I mentioned, we have over 200 people now in quarantine. And the latest date that quarantine ends for those currently in quarantine is January the 21st. So based on our experience throughout this outbreak, we know that a large number of our cases are those who we've placed in quarantine because of known exposures. This would include these 200 plus people that we've mentioned. So we can anticipate that we will continue to see additional cases for those who are now in quarantine. And unfortunately, around each new case, we continue to see transmission in households primarily. I would say over 40% of our cases are a result of household transmission. We are seeing continued transmission in our schools. We are seeing continued transmission as a result of exposures in the churches. So the trajectory that we're looking at now is that we do anticipate more cases well into January. What that means for us nationally in terms of how they are defining our designation in this country as having eliminated measles is unclear, because some outbreaks in other jurisdictions have been declared over. So whether or not that's being defined as continuous and ongoing spread or transmission in this country has yet to be defined.
Thanks, Dr. Bell. And Baker?
Hey, it's Baker Maltsby with the Spartanburg Herald Journal. Wanted to know if the new cases that
and that's what we have right now. And again, this honor the lives lost in that tragic plane crash involving NASCAR great Greg Biffle, his family, and the others that were on board.
Hey, we good?
Sorry about that, folks. As a reminder, if you will please mute yourself if you're not asking a question, that'd be helpful. And thanks. Back to you, Baker. Sorry.
Okay, thanks. Yeah, Baker Maltsby with the Spartanburg Herald Journal. The new cases from a church, were those also Way of Truth Church in Inman, or a different church or churches?
So we have many of our newly reported cases still under investigation. And if we learn of settings where public exposures may have occurred and we have not been able to notify those people directly, we will make appropriate notification of other potential public settings where public exposures may have occurred when we complete those investigations.
Okay, thank you.
And Peyton?
Yes, hi, hopefully. My computer doesn't go off and no one else's computer goes off for this one. I know the vast majority of these folks who are getting the measles are unvaccinated at this point. You said a lot of these are household transmissions. Does that mean that we're seeing some people, a part of these quarantine groups, not taking quarantine as seriously as they need to?
No, that's not what that means. When we say household transmission, it means that there are individuals within a household. They may be in quarantine, but because we can have several individuals within a single household who are unvaccinated, we're seeing transmission within those household settings among people who are in quarantine. I want to take this opportunity to remind people, though, that if they are in quarantine and they make it out of quarantine without becoming ill, they can be vaccinated. So this would be a means to prevent transmission within households if they know that they've been exposed and other household members have the disease.
Thank you, Dr. Bell. And Sadi?
Hi, Sadi from Reuters on this side. Could you please tell me if there is any holidays element to additional number of cases compared to last week's update?
I'm sorry, could you repeat your question?
Could you tell me if there is any holidays element to the additional number of cases? I think the last time we got the update, it was just 3 additional cases, and this time it is 20 additional cases, which is a significantly large number from the last time. Do you think it is due to holidays or like Christmas or due to New Year's?
Well, yes, we've previously reported our concern about the holidays because they involve a lot of family gatherings and a lot of travel. And that was a concern that those kinds of holiday-related activities could result in more people being exposed. And so we do believe that the holidays contributed to this in terms of activities that people may have participated in without being as cautious as they could be, and sort of opting to just participate in other activities without paying attention to disease transmission in our communities.
Thank you, Dr. Bell. And Luis Alfredo?
Hi, yeah, Luis Alfredo Garcia, South Carolina Public Radio. My question was actually kind of answered by the last two, but I guess I'll ask a follow-up. You said you believe that holiday gatherings, I guess, might have contributed to, the 20 cases instead of the 3. Is this a belief, or do you know of any people who did break quarantine as we passed the holiday season? Thanks.
Right. And so we're very fortunate, and we're very appreciative of the number of people who have complied with our guidance to observe quarantine if they are aware that they have been exposed. There may be some people who could be spreading the disease unknowingly. So I'm not saying that these are breaks in quarantine. As I have mentioned earlier, we're seeing a large number of our cases as a result of household transmission. So if households or families in an entirety are opting not to be vaccinated, and that entire household becomes at risk. So it is transmission in households. Over 40% of our cases are a result of household transmission. We're also seeing the outcomes of school-related exposures. If we've had children who have attended school before they were aware that they could have been transmitting measles, and then we've had students excluded from school settings. So all of these are contributing factors to this ongoing spread. And again, the way to stop that is if we could get our vaccination status up so that unexpected exposures would not result in infections because people are protected even if they're exposed.
Thank you, Dr. Bell.
Thank you.
I don't see any other hands raised, but I'll give folks a second. Oh, Tom. Looks like Tom's raised his hand.
Hey, Dr. Bell. A while back, you had mentioned that you were hoping to get some updated vaccination numbers, and I think you mentioned that at the last briefing. Do you know if there has been any uptick in vaccinations, particularly in the Spartanburg area?
I think what I mentioned before is that we're doing that on a monthly basis. So we plan to evaluate the uptake of measles vaccination and for the month of December in Spartanburg County and statewide. And so what we've been reporting previously is when we did those comparisons for the month of October and November of this year as compared to previous years. And so we will do that look back at the end of December and see where we are with uptake for vaccination for this month.
But also, do you know if you're receiving any requests for increased requests for clinics at this point?
Well, we're not monitoring clinic appointments, and we have made notice of the availability of our mobile health units, and we are not scheduled to hold any more mobile health unit clinics at this time. So whether or not people have scheduled appointments to get vaccinated, what we are monitoring is those who have received vaccination. So I can't speak to what we might anticipate in terms of scheduled appointments and what we're looking at in the future.
Okay, thank you. All right, and Baker?
Yes, I know that you can't say a whole lot about those who have been hospitalized, but I am trying to figure out how to word this. Y'all said it's both children and adults hospitalized. Is that 2 children and 1 adult, or among the 3, or 1 adult and 2 adults and 1 child? Again, just trying to figure out how to word that. And then I wondered if you could tell us which hospitals these patients you were admitted to.
No, we won't provide additional details because of to make sure that we're preserving confidentiality and privacy. So among those cases that suffered from complications and had to be hospitalized, the point is that adults and children were among those 3, and we won't break that down further because the point that we want to make is that very unfortunately we are seeing those complications and not the specific details of the individual cases.
Thank you.
All right, and do we have any other questions? Well, barring any last-minute questions, I just want to thank everyone for attending. Thank you, Dr. Bell, for your time. This will be uploaded to our YouTube channel once we conclude. And if you have any additional questions that come up later today or this week, feel free to reach our media relations team at media@dph.sc.gov, and we're happy to answer.
All right, everybody, we have more for you on this New Year's Eve here on WCNC Plus. We'll be back in 2 minutes. All right, everybody, welcome back. It's a big night, obviously, for New York City Mayor-elect Mr. Mamdani, as he is in a new era of New York City and getting ready to be sworn in at midnight tonight. So we did have a press conference earlier about what's going to happen tonight. Let's listen in.
Good afternoon, everyone. The great W.E.B. Du Bois once said, "We should measure the prosperity of a nation not by the number of millionaires, but by the absence of poverty and the prevalence of health." By that measurement, our city is anything but prosperous. Too many of our fellow New Yorkers live lives of poverty and suffering, and too many others live lives where health is nothing more than a rumor of something they cannot afford. When I take office in 2 days, I seek to change not only the measure of the well-being of those who live in our city, but those also tasked with the work of measuring. We are here today at Elmhurst Hospital, which serves over 1 million patients annually, and so often feels the pain of poverty and ill health more acutely than anywhere else in our city. If anyone should hold the public's trust in the work of transforming a healthcare system full of disparities and fighting for New Yorkers who most need the services our city can provide, it is the leader who has guided this institution through moments of adversity and success. I am proud to announce that Helen Arteaga will serve as my Deputy Mayor of Health and Human Services. Helen has served as CEO of New York City Health and Hospitals Elmhurst since February of 2021, the same hospital that saved her and so many other New Yorkers' lives during COVID. Her tenure has been transformative, with the hospital delivering consistent improvements in care to its patients and making historic strides to support its frontline healthcare workers. It's the kind of leadership that Elmhurst residents came to expect from a daughter of the community, someone who grew up like them, cared about people like them, and understood that New Yorkers with less are often treated with less. That leadership, driven by empathy and guided by an unshakable belief that every New Yorker deserves a life of dignity, is no less than what the people of this city will expect from their new deputy mayor. As deputy mayor for Health and Human Services, Helen will have incredible power to make our city healthier and more prosperous. This is work which will demand all of government coming together, which is why I'm thrilled to also announce my corporation counsel today, Steve Banks, a name that many of you will be familiar with. Steve's legacy of service is second to none. As the former attorney-in-chief of legal aid, Steve helped some of the most vulnerable New Yorkers get back on their feet. And as the commissioner of the Department of Social Services for 7 years under Mayor de Blasio, Steve overhauled our shelter system, helped over 175,000 New Yorkers find permanent housing, and fought for low-income tenants. There is a reason that after leaving office, he was described as the most effective social services director in New York City history. His reputation as a champion of those otherwise forgotten is recognized across the city. I am grateful to him for returning to public service. As New York's Corporations Counsel, he will be our city's lawyer, managing hundreds of attorneys and representing our city in court. It is an incredibly important role with wide-reaching and far-reaching implications, and there's no one I would rather turn to than Steve. Finally, as today is the day of announcements, and we are speaking of counsel, I am delighted to announce that I am naming Ramzi Qasim as chief counsel. Ramzi will be joining the administration from CUNY, where he serves as a professor of law. Government service is no novel concept for Ramzi, who served as a senior policy advisor for President Biden from 2022 to 2024, and has deep experience arguing in court, including before the Supreme Court. I will turn to Ramzi for his remarkable experience and his commitment to defending those too often abandoned by our legal system. City Hall will be stronger with him in it, and our work of building a more prosperous city for all will have a powerful advocate. My sincere hope is that New Yorkers who have long felt on the margins of this city, the homeless veteran straining to survive, the patient searching for the care that they need, an immigrant trying to get by, will feel that they now have leaders in their corner who understand their struggles and care to fight for them. That is the city I want to build, the prosperity I intend to deliver, and the leadership that has too long been lacking. Thank you, and please join me in first introducing Ramzi Qasim, my new chief counsel.
Good afternoon, everyone. I'd like to begin by thanking the mayor-elect for what feels both like a privilege and a calling, frankly, an honor and a call of duty to serve the city that I've called home, the city that embraced me. I grew up in war-torn countries in the Middle East, authoritarian regimes, and New York City was really my first stable and permanent home. And this is an opportunity for me to repay that debt. I've been trying to repay that debt ever since I came to this country, ever since I immigrated. Service has been the lodestar of my career, of my professional life, whether it's service, as the mayor-elect mentioned, at the White House, or at CUNY, one of the oldest and largest public institutions in our country, and specifically at a law school whose motto is law in the service of human needs, to give back to working class New Yorkers and serve their social mobility, or whether it's through the clinic and nonprofit that I founded, CLEAR, in service of clients, communities, and movements nationwide. Service is what I look to do and what I hope to do alongside the mayor-elect and his team at City Hall to defend the rights of all New Yorkers without exception, and to create space for the mayor-elect and his team, this administration, to deliver on the promises and the agenda that was so enthusiastically embraced by our fellow New Yorkers. So again, I thank the mayor-elect for this honor, and I look forward to speaking with all of you.
Now I would like to call forward a friend and soon to be a partner in our administration, Steve Banks.
Good afternoon. Thank you, Mayor-elect, for nominating me to lead the New York City Law Department and for your very kind words. If only my mother and father could hear your words. During all my years as a legal aid lawyer and then as a city commissioner, they wondered what I was actually doing with my law degree. Your words would have given them a lot of nachas. I have a unique perspective on the law department. For 33 years as a legal aid lawyer, including 10 as head of the organization, I litigated against the law department. For 8 years as a city commissioner, I was represented by the law department in both affirmative matters involving access to rental assistance, SNAP, food stamps, and Medicaid, as well as matters defensively protecting and addressing the right to shelter. During my time at Legal Aid and in the years since I left city government in 2021, I've also co-counseled with the law department in matters relating to the right to shelter. I know firsthand the key role that the staff of the law department can play in supporting the mayor-elect's vision and agenda for transformative change to help New Yorkers in every community of the city. I'm honored to be the first legal aid lawyer ever nominated to be the Corporation Counsel, and I'm ready for this leadership role. You see, the Legal Aid Society had 1,100 lawyers. That's even more than the numbers of lawyers at the law department. So I'm ready to manage a large law firm like I did at the Legal Aid Society. And in addition to the well-known major cases that I've litigated and handled for low-income and working New Yorkers, over the course of my 44 years as a lawyer, I've represented large numbers of individual clients whose lives have been harmed by city actions. This has provided me with a unique vantage point on the human impact of city policies and practices. The law department can play an essential role in addressing the human impact of such city conduct. Finally, my wife of almost 40 years, who I met on a picket line, by the way, during a legal aid strike in 1982, she and I have been blessed over the past year with 2 grandchildren. I'm ready to take on this role because I know that under this mayor, the Corporation Counsel, and the staff of the law department can help make this city a better place for our grandchildren, for every New Yorker, and their children and their grandchildren. Thank you again, Mayor-elect, for this opportunity.
And now, our new Deputy Mayor for Health and Human Services, Helen Arteaga.
Buenas tardes, everyone. Good afternoon, and welcome to Elmer's. I want to thank the Mayor-elect Mandami for this trust and faith in appointing me Deputy Mayor for Health and Human Services. At this important moment in our city, it's not lost to me that the agency under this portfolio are the safety net for so many New Yorkers who are looking to survive or sometimes get a second chance. Whether they're visiting our hospitals, entering our shelters, or going to our after-school programs, or just aging out of foster care. It is that workforce and those providers in this portfolio that work so hard to get these New Yorkers through the hardest times in their lives. To that workforce and those providers, I say, I'm ready to work alongside you to provide innovative solutions so you can take advantage of every opportunity, every interaction to address the affordability crisis that brings so many to our doors. To every New Yorker that trusts us enough to show up, and to those that are suffering in silence wherever you are, because they do not know if government will protect them or treat them with dignity, I promise you today that I will work so hard to ensure that you are seen and that we are thinking big and courageous about solutions that will allow you to thrive in the city that we love. You see, I see you because your struggles are mine. I am who I am because of them. I want to thank Mayor-elect and the team for indulging this appointment here at Elmhurst Hospital, because you see, here is where my advocacy was born. It is here when my dad died without having lack of insurance. It was here that I survived COVID. And it's here that I want to say, Madre, tu sacrificio valió la pena. And it is here that I serve as a proud CEO for the past 5 years. Like the mayor-elect, I'm just another immigrant kid from Queens. But the two of us are ready to take everything that we learned from our culture, our families, and our upbringing to make big changes in New York City, the city that has loved us so much. So to Dr. Katz, my H&H family, and my Emil Strong family of 6,057, know that I'm super grateful for these last 5 years. Thank you for showing up. Thank you for learning together, for growing together, for crying together, and for overall coming together for our city. When I walk through the doors of City Hall in like 2 days, I'll be walking in with all of you inside my soul and my spirit. But now I'm ready to work on something really cool. I'm ready to work on the mayor's-elect vision and dream for New York City. Mil gracias.
I'll take questions in one moment, but I just want to quickly just give
We'll start with on-topic questions, please, and for everybody. For the mayor, like the DM, the Department of Community Safety, we haven't heard that much about how this is going to operate like yet. Is this going to be under the DM, or is this under something just
The Department of Community Safety would fall under the first deputy mayor's portfolio. However, it will require a whole of government approach and commitment, and I look forward to working with our new deputy mayor in ensuring that.
Yeah, go ahead. Yeah.
Hi, Mayor-elect. The comptroller released an audit this morning declaring that the health insurance stabilization fund, which helps pay for supplemental benefits for city workers, is insolvent, recommending that it be dissolved. He found that it has outstanding liabilities of $3.1 billion. That is obviously not nothing. Would like to hear your response. And also, what do you say to city workers who are perhaps concerned about their health coverage?
Well, to city workers, I will say each and every day that this will be an administration that takes your concerns seriously and looks to do more than that. It looks to actually deliver on them. And the report, as well as any other analysis, is something that we are going to take seriously as we assume office in a few days.
Mayor-elect, this constellation of advisors seems like it could really be at the intersection of potentially combating efforts from the Trump administration, from beefing up the law department to prevent deportations, as you've mentioned, to pending SNAP and other benefit cuts. Have you had kind of a conversation with this cohort about the approach to the Trump administration, and what are your first few initial actions you're going to take relative to these top advisors and what you're instructing them to do relative to the Trump administration?
Well, I think it all comes back to the welfare of New Yorkers. And what I am so excited by, frankly, in each and every one of these appointments are New Yorkers who are committed to not only protecting those who call this city home in terms of their rights and their freedoms, but also in terms of their ability to find care in a city where too often healthcare is something that is synonymous with being something that is unaffordable. And I think that even in my own conversations with the president directly, I will always and have made the case for this city. I look forward to my top staff doing the same.
But is it that you would first pick up the phone and call the president if you didn't get along okay? These guys go at him? Is that kind of the approach?
I will look to have a conversation with anyone and everyone. And also, I think it's important that there are fights and freedoms that will be protected in conversations. There are fights and freedoms that will be protected in court. There are a number of active court cases, frankly, that I look forward to working on with my nominated corporations counsel to ensure that our actions as a city are furthering the protection of the rights of the people who call it home. Thank you.
Question for both the mayor-elect and the new deputy mayor. First, mayor-elect, you have very limited time left before you take office. Are you planning to announce your next schools chancellor and transportation commissioner in the next 24 hours? Just trying to gauge where you're at with that. And then deputy mayor as well. Are you still going to have a role here at the hospital, or are you going to be leaving permanently? Thank you, guys.
So to the first question, I'll give you the answer you don't want to hear, which is wait and see.
I would not be leaving my home here at Elmhurst Hospital if it wasn't something important, and working with Mayor-elect and his vision and his dream is something that I want to do because I see the impact. But more importantly, it's going to take a lot of work, so I'm going to dedicate 100% to the vision.
Yeah, Joe.
I have a question for Steve, the nominee. I was wondering, could you, observing from the outside, is there anything you feel like you want to do differently about how the law department has approached the litigation with the Trump administration? It's sort of how it handles the work with immigration that city and state do together.
Thank you. Thank you for that question. Let me take a little bit of a step back. I've been involved with leading two other institutions, the Legal Aid Society and the Department of Social Services, and my first approach in leading both those organizations and making major reforms in both of them was to engage the frontline staff, to understand the nature of the work that they're doing, their views of the work that they're doing, and the kinds of ways that they see that they can play a key role in the front lines of moving forward with the mayor's affordability agenda. So I come to the institution of the New York City Law Department with that same approach, that in order to move an institution forward, you have to engage the people who are doing the work and move forward on that basis. At the same time, the mayor's been very clear about what his vision is, what his values are, and the law department's going to be a major part of that when legal responses are needed. One thing I know as a lawyer, and I learned as a city commissioner, lawyering is involved in almost everything involved in the acts, the actions that government takes. And so we're going to be very much looking forward to helping implement the mayor's affordability agenda.
And I'll just add one thing, which is that I will demand excellence from my team, from myself, and also I will ensure that we create the conditions where that excellence is possible to deliver on. And what I mean by that is that we have seen a shortage in staffing within the city's law department, and one of the commitments in making this nomination is also to ensure that we provide that same kind of focus in the intricacies of the law department itself, the staffing of the law department, so that our nominated corporations council can actually do the work that we are asking of them.
You said in the past you want a lot of those lawyers to focus on immigration cases. Is that still the case, or are they going to be doing just kind of more normal work too elsewhere in the law department?
Frankly, I think that there is a clear need for a few hundred additional lawyers at the law department just from the beginning of it. And I think that the work will encompass some work in providing legal services for immigrant New Yorkers. The question of the totality of that work I will also leave to my corporations council.
All right,
Thank you.
Chris and then John.
Thank you. Mr. Mayor-elect, and for...
How's it going, Chris?
How are you? Steve's position is obviously subject to council approval. Have you received any assurances from the council that they will confirm his nomination? And follow up on Joe's question.
Let me do that one first. Yeah. Thank you, brother. I have been in touch with incoming Speaker Menon about the nomination of Steve Banks as our corporations counsel, and I look forward to that process.
Got it. On Joe's question, you proposed on a campaign trail to hire specifically 200 new law department lawyers. When you announced that, you said that was part of an effort to kind of Trump-proof the city, to be able to fight back against Trump administration initiatives. Is that pledge still holding? Are you going to hire those 200 attorneys? Are we going to see that in the prelim budget? And if Steve could speak a little bit to how attorneys would be deployed specifically to fight the Trump administration.
That pledge is still continuing, of hiring 200 additional lawyers, and it's also a pledge of thinking about what the legacy of the law department has been for decades. The law department had been on the front lines of many of the fights for equal rights across this country, but today it has been hollowed out. And this is incredibly important for us in the work that we are seeking to do in this administration, that we have a corporations council and a law department that is not only staffed, but is also back on the front lines as opposed to the defensive that we have seen over the last few years.
Mayor-elect, do you support a
No
very
worries.
controversial in the city, but do you support a ban on horse carriages here in New York City? Would
Yep.
you support a ban?
I've said that I support removing horse carriages from Central Park, and I've also said that I look forward to working with union partners and community leaders to actually deliver on that.
All right, I think we have time for just one quick one.
Hey,
How's it going, Dave?
good. Just following up on Morgan, I know you said wait and see, but buses were so central to your campaign.
Yes.
They've been so central. The transit has been so central to a lot of what you talked about in office. So what are we looking for in terms of DOT leadership come January 1st? Is there going to be an interim commissioner, or are we going to have a new person who I get to bother with?
No matter who's there, I know that you'll be bothering them. And I appreciate it because, frankly, what this is about looking for a fealty to a commitment to New Yorkers that are often overlooked. Right? Today we have spoken about it in the context of health, but when we speak about bus riders, we're speaking about more than 1 million New Yorkers who are riding the slowest buses in the country. This will continue to be a focus of my administration and a recognition that it is New York City government that runs the streets of this city, and therefore there is an opportunity in the way in which we approach that, not only to honor the commitments and proposals that have been put forward in prior years, which Streets Blog also broke the news of at a press conference not too long ago, but also, frankly, to think about how do we make this city an example for the world in the ways to get around efficiently and reliably.
Thank you guys so much. All right.
Thank you so much.
I'm sorry.
Yeah, okay. I'm sorry, everyone. But we'll see you soon. I do promise.
It is New Year's Eve, and you can see we've got the ball. Obviously not going to be dropping for a couple of hours, but New York City is obviously alight with a lot of excitement. Many people already in New Year's, or I should say in Times Square, getting ready for the New Year's Eve ball drop. We will cut away from this shot and bring you more live celebrations when we get them. We're going to take a quick 2-minute break and come back after this. All right, everyone, thanks for coming back. We do know that a year ago there was an attack in New Orleans during New Year's, during the morning, and actually victims of that attack, lawyers for the victims, and some of the victims did speak in a press conference calling for more safety measures, especially ahead of New Year's Day tomorrow. So we're going to go to this right now as we listen in.
On behalf of her daughter, Nakira. Nakira, as you might remember, was the 18-year-old young woman on Bourbon Street who tragically was killed by this vehicle. Also, we have Lenny McLean, who was actually hit by the truck, suffered severe injuries, has had multiple surgeries, is still under treatment. My message today is very simple. Number one, I want to commend the city for the steps it has taken this year, this New Year's, this Sugar Bowl, to protect everyone as they enjoy the festivities, as they go on Bourbon Street. There's going to be a huge police presence. They're going to close off Bourbon Street. These changes are necessary in light of the tragedy that occurred last year. But my second point, and perhaps even more importantly, is I call on the city to do the right thing. Do the right thing by permanently closing off Bourbon Street to traffic so that an incident like this never happens again. It's great to close it off over New Year's and over Sugar Bowl, but as all of us who live here in New Orleans know, you can go to the French Quarter any ordinary Friday or Saturday night, and Bourbon Street is packed with people out enjoying themselves and having a good time. This is an ongoing situation that presents huge risk every single weekend throughout the year, and quite frankly, we want the tourists to come and enjoy themselves. It's an easy fix. Nashville has dealt with it. Memphis has dealt with it on Beale Street. You close it off by putting in permanent heavy-duty bollards, not the decorative bollards that Mott MacDonald has proposed putting on Bourbon Street that, quite frankly, our litigation research shows that these bollards will only stop a vehicle going 5 miles an hour. That's laughable. We don't need decorative bollards on Bourbon Street. We need permanent heavy-duty bollards. And yes, I know there's hotels, and yes, I know there's restaurants and bars on Bourbon Street, but just like Nashville, just like Memphis, you can have a delivery window of a few hours, perhaps early in the morning, where supplies are delivered. I don't want to climb down in the weeds on this, but these are problems that can easily be worked out. The main thing for the safety of everyone involved, and in the memory of the horrific situation that occurred when 14 people were tragically killed New Year's of last year, we need to learn by example. We need to learn as to what happened. It's kind of ridiculous when you think about it that a year later, a year after this tragedy, nothing has been done to resolve this situation. There's been committees, there's been reports. We have so many chefs in the kitchen, we can't even make the dish we want to make. Everybody has a voice. Everybody speaks with a different voice. I'm very hopeful that the administration, and I call on the incoming mayor, Helena Moreno, do the right thing. Close Bourbon Street down to traffic, especially on Friday and Saturday night, or any time there's crowds of people on the street. Close it down. Need permanent heavy-duty bollards. We can't rely on the police department every time to have to go there and use their manpower to put bollards in, to take bollards out. It doesn't work. That's obvious. We should know that. The city needs to do the right thing. Now, If anyone has any litigation-related questions, Matthew Hemmer is taking the lead. Actually, our firm has taken the lead on all this litigation since we represent most of the people. We represent 6 of the 14 who were killed and dozens of those that are injured. We're leading the litigation. The litigation's going good. I'll let Matthew address that if anyone has any questions. And then we also have Melissa and we have Lenny here available to take questions. But I would prefer, for their privacy, that we do this on a one-on-one basis. So I have a very nice conference room right next to us, and if there's any questions for us as a group, we can take that. Or if any of you would like to do one-on-one interviews with them, we'll make them available in a much more comfortable surrounding for them in our boardroom. So, thank you for coming out. I'd like to wish all of you, all of your viewers, a happy and safe New Year's. Thank you.
Morris, before we get to that, have you spoken to Helena Moreno about what you think should happen?
So I was, Helena Moreno placed me on the Public Safety Committee of her transition team. So I have had a voice in that regard, and quite frankly, I was very impressed with the people, from Chief Michael Harrison. There was some of us from the DA's office. I say some of us because, as you might know, I'm a volunteer assistant DA in Jason Williams' office, and I'm still working closely there and closely with the 8th District in the NOPD. That was discussed. That was brought up. Of course, is the limiting factor about the funds available to accomplish what we need to accomplish. The budget is a big problem. Mayor-elect Moreno has said that she's not going to cut the budget for public safety. So assuming that's the case, we should be able to accomplish these things. I am a strong advocate and have been, and quite frankly, I think anybody that lives in New Orleans knows the solution is so simple. You close Bourbon Street to traffic. It's as easy as that. I will advocate for that. If the mayor-elect gives me a future role on the Public Safety Committee or anything to deal with this plan on Bourbon Street, I'm happy to participate.
Regarding the litigation, can you just kind of walk us through where it's at now and the next steps for the families?
You're talking about the litigation?
Yes.
Sure. I'm going to turn it over to Matthew then.
Fantastic.
And Matt, could you spell your first and last name for us?
Yes, ma'am. It is M-A-T-T-H-E-W. Last name Hemmer, H-E-M-M-E-R.
And where does the litigation stand currently, and what are you, walk us through what's those new information?
So right now we're in discovery, and we're only now just entering discovery. You know, it may not surprise you to believe that some people don't like to take responsibility or accountability for things. So while we've been in the courthouse for 11 months, we've really been mired in motions. I was disappointed that some of the defendants chose to try and file motions asking for the court to throw it out rather than start digging into it. But I was pleased to see that Judge Barrial and the court took the time to hear everything and rightfully denied those motions, opening the doors for us to really start digging into some of these issues. We have since sent all of our written questions and requests for documents to the defendants, and we're just waiting on production to those requests. There is no reason why we can't start taking depositions in March. I would ask for all the defendants to do what they can to clear their calendars so that in March we can start sitting down with people and asking questions, asking the hard questions to find out how this happened, who made these choices, who was the one who said, leave it wide open, leave the door open. To me, these are things that you shouldn't have to wait 15 months to start sitting down and asking people.
Who are the major defendants?
Mott McDonald. Mott McDonald is the defendant we believe to have the most responsibility for this. There's also a contractor, Hard Rock Construction, and because this is a public street and because the city does have responsibility to some degree for all public streets, they are also named as a defendant. But as we dig more and more into this, what we really see is that the city may have found itself in the position of hiring someone that just didn't do a good job. And I think everybody can relate to the situation of having a problem, having a sink break, having a light go out, and going out and trying to hire someone to do a good job and fix it. You don't always have control over whether or not that person does a good job. And I think there's a chance here that the city went out and hired who they thought was the best in Mott McDonald, and unfortunately found themselves the victim of someone who didn't do a very good job.
If you can share, is there anything that you guys have found up to this point that is shocking, or you think the public would kind of like, oh my gosh?
You know, the defendants said that this was unpredictable, that no one said this could have happened. Shortly after seeing that written in a paper they filed, I received a copy of a presentation that Mott McDonald made to our city in April of last year, months before this happened. And I'll tell you, they must have a crystal ball, because months before this happened, Mott McDonald told the city, here's a picture of a white F-150 driving down Canal Street and turning right onto Bourbon. Think about how terrible that would be. That's the problem, and that's what could happen. But we'll fix it. Okay? We'll prevent that from happening. We'll be responsible. When I saw that eerie prediction months before this could have happened, it really drove home that this was a predictable, preventable, and unnecessary tragedy.
I can add something shocking that I found, and that is to put in perspective, the bollards that were in place prior to January 1st were heavy-duty bollards that could withstand a vehicle collision at 40 miles an hour. The problem was that those bollards were on tracks. Debris got in the tracks, and so the bollards couldn't open and close like intended. Mott McDonald said, let's replace those with a different type of bollards. They took out the bollards, the heavy-duty bollards, and of course, while the bollards were out is when January 1st occurred. However, the bollards they were going to replace them with, and they did replace it with, came from a company, believe it or not, called 1-800 Bollards. And these bollards are what's called decorative in front of a storefront. They only withstand a collision of about 5 miles an hour, meant to prevent a car that might be inching forward in front of a store and goes too far and just hits the bollard. It slows it down. They're not meant to prevent a vehicle. January 1st, it was quickly
Thank you, Minnesota. There's actually a Washington, big, powerful congressman, but you did a great job today, Tom. Thank you very much. We all appreciate it because we want to take back our country. Can you imagine? They stole $18 billion. That's just what we're learning about. That's peanuts. In California is worse, Illinois is worse, and sadly, New York is worse. A lot of other places. So we're going to get to the bottom of all of it. It was a giant scam. Other than that, we're going to have a great New Year. Actually, I view that as a reason for a good New Year because we're going to get to the bottom of it. We're going to get that money back. It's all coming back. So I want to just do something very special. This is very different.
All right, folks. Hey, we do want to let you know that the NOLA victims press conference is coming to an end. So we're going to take the president in full and listen in right now.
She did something last night that was incredible. She can paint slowly a beautiful portrait for the White House, or she can paint the most incredible painting in literally 10 minutes. And she's a speed painter, and she's a great painter. But I think she's one of the great living artists. And I said, do you think you'd be able to stay and interrupt the music for a couple of minutes and show them something special and draw something really special? I don't know what it is, but draw something really special. And if it's really good, what I thought I'd do is come back up and I'll auction it off. And I'll start with a certain number. But we have money in this room. It's ridiculous. It's ridiculous. So we'll maybe auction it off afterwards. But I think you're not going to really believe what you're going to see because I've never seen anything like it. So if you could just pay a little attention, because it's very different. It's entertainment, but really what it is talent. She's one of the greatest artists anywhere in the world. Vanessa, would you please come up? Thank you. Thank you.
All right, folks, we're going to take a quick 2-minute break. Of course, we'll monitor the situation happening in or at Mar-a-Lago, at Palm Beach, and we'll come back in 2 minutes. All right, as many of you know, 2025 coming to a close tonight. In fact, we have a 2025 year in preview package for you right now.
2025 began with back-to-back tragedies. New Year's celebrations turned deadly in New Orleans. A terror attack shutting down the city's famed Bourbon Street. Just days later,
we drove up and I just kept saying, my home, my home.
Deadly and destructive fires tear across Los Angeles, destroying thousands of homes.
We wanted to see for ourselves what the damage was, but it's gone. It's gone. It's a total loss.
Heartbreak in Texas. Young girls attending summer camp among the more than 130 people who lost their lives in catastrophic flooding.
Please pray for our community.
And tragedy in our nation's capital. A passenger jet colliding with a U.S. Army helicopter, the deadliest U.S. plane crash in nearly 2 decades.
I, Donald John Trump, do solemnly swear.
Donald Trump returned to the White House. Job and spending cuts, tariffs, and immigration enforcement and raids becoming political and social flashpoints. Court battles, protests, and marches playing out across the country. The president claiming there was widespread crime, ordering National Guard troops to several U.S. cities, leading to clashes with protesters.
We're trying to solve a problem. Don't tell us what we're going to feel.
I'm not telling you.
Because you're in no position to dictate that.
That's
Remember
exactly
this. You're in no position to dictate what we're going to feel.
A White House shouting match as Ukrainian President Volodymyr Zelensky, President Trump, and others met about Russia's invasion into Ukraine. Months later, a red carpet welcome for Russian President Vladimir Putin landing on American soil. But the high-stakes summit in Alaska did not end with a deal to end the Russia-Ukraine war. 2 years after Hamas attacked Israel, a ceasefire agreement reached. The last living Israeli hostages held by Hamas released in exchange for the release of Palestinian prisoners and detainees. In October and November, we saw the longest government shutdown in U.S. history, fights over health care dividing Congress, the 43-day saga ending with a deal to reopen through January. 6 years after his death, convicted sex offender Jeffrey Epstein back in the spotlight. A twists and turns saga from the White House to Capitol Hill as survivors pushed for release of the so-called Epstein files.
I know everybody sees us today as grown adults, but we are fighting for the children that were abandoned and left behind in the reckoning.
We're not counting gang violence.
The assassination of conservative political activist Charlie Kirk stunned the country.
It is an attack on all of us,
It is an attack on the American experiment. It is an attack on our ideals.
Comedian Jimmy Kimmel following criticism and political pressure over comments related to Kirk's death taken off air. Free speech protests ensued before Kimmel eventually returned to hosting his late-night show the following week. And our nation said goodbye to political pillars. The 39th President Jimmy Carter honored. And Dick Cheney, Vice President under George W. Bush, also remembered. Tributes poured in across the globe after the death of Pope Francis. White smoke revealing the first Latin American pontiff would be replaced by the first American Pope, Leo XIV, a Chicago White Sox fan turned leader of the Catholic Church. A brazen heist at the world's most visited museum. Thieves robbing the Louvre of jewels estimated to be worth more than $100 million. And after what was supposed to be a short mission to space stretched into more than 9 months, NASA astronauts Sonny Williams and Butch Wilmore finally returned home.
Thank you to a nation that got involved in all of this. It makes it special, not just for us, but for all, I think our nation as a whole.
Pretty honored and humbled by the fact of when we came home, like, wow, there are a lot of people who are interested.
I'm Michael Yoshida reporting.
All right, guys, cannot forget, obviously, pop culture of 2025. So we're going to go to this package real quick before we round out our 2 hours here on WCNC+.
It was a good year to be Bad Bunny.
You're fired.
Fired? The rapper dominated the charts while giving Puerto Rico a boost with his historic residency. Taylor ended her record-breaking tour, then swiftly launched a new era.
This is my brand new album.
Her 12th album, and weeks later her engagement, the Kansas City Chiefs tight end Travis Kelce.
Slime Cube.
On the big screen, a movie inspired by a video game ruled the box office, while K-pop Demon Hunters became the most streamed movie ever on Netflix, powered by an infectious soundtrack featuring the song Golden. Also golden, Anora winning the Oscar for Best Picture.
Welcome to the pit. Let's go save some lives.
Freshman TV shows The Pit and The Studio.
Everyone wants something from me, and I can't give it to them.
Both victorious at the Emmys.
Cowboy Carter.
And Beyonce, who won 3 Grammys, finally taking home the trophy for Album of the Year.
I just want to encourage people to do what they're passionate about.
With that, the world finally made sense. Until it didn't. The inexplicable 6'7" trend took over social media, and this kiss cam moment from a Coldplay concert became an overnight sensation. Late night TV was rocked by 2 earthquakes. CBS canceled Late Night with Stephen Colbert. Then ABC briefly suspended Jimmy Kimmel for comments made after the assassination of conservative activist Charlie Kirk.
The MAGA gang desperately trying to characterize this kid who murdered Charlie Kirk as anything other than one of them.
For another late night staple, it was a year of celebration.
Live from New York, it's Saturday night.
Saturday Night Live marked 50 years with a star-studded special.
I eat 4-cheese lasagna.
Also celebrating half a century, Jaws. While Peanuts turned 75, and the Radio City Rockettes high-kicked their way to 100. On the diamond, the LA Dodgers repeated as world champs, and the Eagles flew to a Super Bowl win. Green on the gridiron and in the theater.
I'm off to see the wizard.
The final chapter of Wicked from our sister company Universal Pictures gave fans something to sing about for good. Joe Fryer, NBC News.
What a year it has been, and we have 30 seconds. We do want to let you know about Panthers on the Plus happening at 9 o'clock in just a couple of minutes, and then we will have a special news for you tonight at 10 o'clock on WCNC Charlotte before things get going. But we do have a watch party on Saturday at 4 p.m. for the big game, and again, Danielle Stein will be live from Tampa starting on Friday ahead of the Carolina Buccaneers game. Don't forget, again, WCNC Charlotte will be on at 10 o'clock. Give you a shot of the ball in Times Square right now as they are counting down to New Year's.